Buoy Health Insights, toe pain. Welcome to another episode of Buoy Health Insights, where we dive into common health concerns and their potential causes. Today we're focusing on a topic that might seem small but can be a big nuisance in everyday life: toe pain. Have you ever woken up to find your toe hurts or felt pain while walking that is concentrated in your toes? It's not just an inconvenience, it might be an indicator of an underlying health issue. Toe pain has a variety of causes, ranging from injuries to medical conditions. Some common problems include bunions, toenail issues, sprains, fractures, as well as diseases such as gout and diabetes. Let's explore some specific conditions that are linked to toe pain. First, there are medical illnesses like psoriatic arthritis, which is a complication of psoriasis, where both the skin and joints can be affected. It is an autoimmune disease, meaning the body mistakenly attacks itself, and it can lead to painful, swollen, and hot joints. Rheumatoid arthritis, another autoimmune condition, can also lead to painful toes. Then there's Morton's neuroma, usually a result of years of trauma or compression to the feet, often due to tight shoes, which leads to a thickening of tissue around the nerve between toes. This can cause a burning pain in the ball of the foot. Gout, a type of arthritis, can also be the culprit, especially if your big toe is suddenly painful, stiff, and swollen. This condition could be linked to your diet and the production of uric acid crystals within the joints. Infections like paronychia, caused by bacteria or fungi, might also be why your toe hurts. If you have an infected nail bed, the area around your nail can become sore, reddish, and swollen, sometimes even with pus. Other potential causes include Raynaud's phenomenon, which affects blood flow to the extremities and can cause numbness and color changes in the toes when exposed to cold temperatures. If you're experiencing mild toe pain that seems to stem from a minor injury or overuse, at-home treatment, including rest, ice, and over-the-counter pain medication, might be enough. But it's important to know when professional medical advice is necessary. You should consider seeing a doctor if you have chronic toe pain, signs of infection like redness or pus, if you are diabetic and have a foot ulcer, or if you are simply unsure about the cause of your pain. A healthcare professional can provide steroid injections, prescribe medication for conditions like arthritis, diabetes, or infection, recommend orthotics, and in some cases even suggest surgical solutions. And remember, if you have severe pain, swelling, or difficulty walking, it's best to seek immediate medical attention. In the meantime, here are a few quick tips on potential causes and their accompanying symptoms. If your toe pain is accompanied by skin changes, joint deformation, or nail problems, you might be dealing with an autoimmune disease. Severe pain with redness and swelling might suggest the presence of gout or an infection. Chronic pain in the ball of your foot, especially if you wear tight shoes, could point toward Morton's neuroma. If you're suffering from nighttime toe pain, conditions like Morton's neuroma or diabetic neuropathy could be the reasons. Diabetic neuropathy is particularly concerning because it may lead to ulcers and potential complications if not managed properly. So what can you do about toe pain? Well, prevention is key. Wear properly fitting shoes, manage your exercise routine to avoid overstraining your feet, and be mindful of your diet to help prevent gout. Before we wrap up, don't forget to like and subscribe for more health insights. And remember, your health is valuable, so take the time to understand and take care of your body. Thank you for joining me today, and stay tuned for more episodes of Buoy Health Insights.